The information we're sharing is for informational purpose only. It is not and does not qualify as medical advice. Any treatment decision you're making should be done in consultation with a qualified healthcare professional. The following is a chat for men about menopause. Our intention is to share information about perimenopause and menopause, and we want to bring to your attention what changes your partner, your wife, your spouse might be going through, and also what you can do to keep the relationship happy. I'm very happy to have with me Dr. Vanessa Wong. She is a psychiatrist in her own practice here in Hong Kong.
My name is Vanessa, as you said. I am a woman in my mid-40s and proudly going through perimenopause. So today I wear two hats, one as a psychiatrist and also one as a woman, just sharing what I'm going through.
Looking into the couples process now, and we want to address some concerns and questions around the relationship, the change in intimacy that is affected, probably affected, and also treatment options, as much as you can share on this side. My first question here really is, do you treat menopause, perimenopause in your practice as a couples process?
Well, for me, it's more from the patient point of view, and usually I treat an individual. But obviously, the topic of how it affects the couple relationally will show up. And so if I've met the partner before, I have a sense of who that partner's personality is like, how they communicate. So maybe a little bit of general advice, but in terms of couples work, usually I would refer out.
I asked that question. You and I had conversations around how important the communication is, and that the channels are open, that we are present with what we have as an experience in both of us in the couple, and to address that. At what point should couples seek professional help or medical advice?
I think it's the same with any life changes, right? If you feel that communication has broken down pretty much permanently, you're not able to talk to each other without it creating some kind of conflict or things dredging out, the communication style is probably not helpful at that point. You feel very alone and very stuck in the relationship, right? Sometimes we can be in a room full of people, you can be with your partner and still feel very much alone. If you feel persistently depressed and anxious, you're getting panic attacks, you are tearful, you're having really dark thoughts, I think that's the time to also seek help.
In terms of treatment, Vanessa, how do you handle that from a medical perspective? What are the options? I heard about hormone replacement treatment. How much do we need to know as the male partner here?
Yeah. Well, I think from a psychiatrist's point of view, women will present with depression or anxiety symptoms. It's very rare for a woman to come to a psychiatrist and say, I am here for treatment of perimenopause, right? Because a lot of the times that might be handled by their OBGYN or their GP or their endocrinologist. So for me, I see more the mental side of the picture. But digging deeper, you will find, like we spoke earlier, maybe there is a hormonal piece there. So either we need to work in conjunction with their primary care or their OBGYN, or sometimes I just, offer a little bit of hormonal replacement as well.
Yeah. Okay. So that makes a lot of sense to me. So when there are symptoms arising in the mental health, emotional regulation area, anything around mood, around anxiety that comes up, but also we talked about the cognitive capacity, the brain fog, then that would be something where they might see you and you might have an idea what is happening, and then you work in conjunction with other medical health providers, doctors. Vanessa, the hormone replacement treatment, how much can you tell us about, from the male perspective, what's the magnitude, how much can it help, can it alleviate all the symptoms, is everything okay when we start that, what to look out for, and then maybe also, if I may already ask that, going into the libido, the sexual intimacy, the physical intimacy dimension of it.
Yep. Well, so hormone replacement therapy or menopause replacement therapy are medications that we can use to help support a woman through this perimenopause period. And some women may choose to continue it into their menopause. But every woman has a different profile. They have a different set of risk factors. So this has to be taken into consideration when a woman decides to go into hormone replacement and for what reasons. So things that hormone replacement therapy can help with are the physical symptoms. So because it stabilizes your hormones, so instead of having this going on, we just give you a pill, so it's more of a flat, smooth, even profile in your body. So then it evens out the changes of the hot flashes. It protects your heart, it protects your bone. It gives you some, stability in terms of how your body is biologically functioning. And sometimes, yes, it could help with things like libido and sexual drive because your physical organs are functioning better, right? So there's less vaginal dryness, there's more, reciprocity in that sense. However, sex still begins in the head, right? We still need to feel wanted. We still need to want to be desired. We still need to have a lot of intimacy in a relationship to provide that sense of safety for us to be vulnerable with another person, to share, right? To take pleasure in ourselves in that sense. So even if you take a hormone replacement and the sex doesn't happen, it doesn't mean that the hormones aren't working. It just means that there's something else that may need to be addressed.
Okay. Very good. Thank you. So I take away from this that the physical symptoms can be mitigated, at large, if I understand it correctly, and that would take away the physical discomfort and what comes with that, the stress that comes with that for a woman. Does it work for everyone? How big is the range of and what are possible downsides, risks to probably track or to look out for?
It doesn't work for everyone. If it did, that would be great. But I think it's about finding the right combination of treatment for you as a woman. And sometimes you can also use non-hormonal therapies for treating things like hot flashes. There are other medications for that as well. So it may be that, if you really have depression and anxiety, it's not enough just to support the hormones. You do potentially need other forms of medication. So the question was, can it fit everybody? Probably not. But if it works, then good, right? Just keep reviewing it with your doctor. And I think from a male perspective, it's helpful to have positive language around it, right? Because women already feel quite vulnerable because society values youth and fecundity and that sort of sexual vitality. Whereas when we start to feel our, slow, gradual hormonal demise, we feel less desired, we feel less attractive. And so it's not just that, the hormones replace that sense of feeling. We need to still feel valued in who we are. We still want to feel we are desired as a partner, as a woman. And there are many things that can make you feel feminine without just having sex, right? Like a partner can make you feel wonderfully soft and fluffy and things that come with these positive feelings without actual sex. And so sometimes sex may not be possible because it's just either too painful or, she's too stressed, the hot flashes. When you have a hot flash, you don't want to be breathing down her neck, for example. So the warmest of hugs may suddenly turn into a fire of ball that you want to be away from. So in those times, maybe you need to have intimacy in non-sexual ways. You need to find other ways of communicating that desire for your partner.
Vanessa, if you could prescribe the male behavior, as you just mentioned, as a medication, or what would your dosage instructions say?
The most important thing is to be able to listen actively and not fix the problem. Like women, in the day of internet, right, we have friends who have gone through similar things. We talk about it. We generally have enough information to navigate the medical process. Like if we need to see a doctor, if we need to take supplements, things that we need to do. Internet tells you to meditate and go for long walks. So great, we have information. It's about executing the information as a couple. Right? So things that may not be helpful is if you say, oh, have you tried this? Or have you done that? Have you seen this doctor? Have you taken your meds? Right? It makes the person feel sick. It makes the person feel incapable of taking care of themselves. So switching it around, it could be, I see that you're struggling, or it seems really hard for you to go through this, or you looked really uncomfortable back there. Is there something we can do together? Or tell me how to make it better for you.
Right. Yeah. Right? Oh, thanks for bringing this up, Vanessa. And at this point, I would like to highlight that when I researched and I used AI to look into the topic to prepare for today, I found listening as well. And I know that men greatly struggle with listening because we jump to a conclusion, we jump to a solution, and we think that's what we listened and that's what we want to present. And it's really difficult to then hold back and to not do that, not go into problem solving and to fixing mode. One thing I would like to add to listening and asking open questions is, instead of that, it's far easier to just let your partner know that you're there. Right? What you said before, not to get off the grid, not to disappear, not to avoid the situation, but also not to be overbearing, come in, and just to know, for the female partner to know that you're there.
Yeah.
And that you say, I'm here, I'm not leaving the room, I'm with you, let me know what you need.
Yeah. And we know from, trauma research, from attachment issues, that when a partner is calm and non-reactive and is just present, the calmness is contagious. It helps to regulate the other person's nervous system as well. So if one partner is very reactive and very emotionally dysregulated, if the other partner follows, then it becomes a snowball of emotions. Whereas if one partner can stay, it doesn't mean that you don't show any emotions. It doesn't mean you don't say anything. It just means that you're calm and measured in how you respond. And you're just a solid pillar and a foundation for that person to then regulate themselves around you, because they know that they can be safe in expressing their emotions without it backlashing or firing back.
How do you know a man is really calm?
I think body language helps. Eye contact helps. Right? It depends if your partner is open to a little bit of, physical touch in that point, just holding her hand or just stroking her arm or something like that. I think every partner has their different dance. So it's reading your partner's, being attentive, right? Like if you are dysregulated, it's hard to pay attention to someone else. So the fact that you're able to pay attention to her means that you are calm.
Right.
Yeah.
Thank you. And I, of course, asked that question because I want you to know if you're calm and when you're calm, because that is actually your job.
Right.
Vanessa, so one other thing that came up or comes up, sleep and sleep arrangements.
Well, I think society expects that a couple should share a bed together, because if, they don't, something must be wrong with the relationship. One got kicked out of the bed or something. However, sleep experts do say the best sleep you get is the one you get on your own. So especially with perimenopause, if the woman is experiencing a lot of discomfort physically, like hot flashes, night sweats, just feeling more easily woken up in general, then maybe you need to separate the sleeping space, because she might need a different temperature or a different type of linen or a different firmness of a mattress or something like that, or she's more easily startled by noise. And it's one of those things that requires a lot of skill to navigate the conversation, because you don't want either party to feel abandoned, right? I don't want you, you're not, I don't want to be next to you. But also, it also requires a little bit of coordination. If you still want intimacy, then maybe you need to time it so that you do have intimacy, but then you can sleep separately. Or one person comes to the other person's bed in the morning just for a wake up, good morning and things like that.
Like we did on any good summer camp.
Yes. So it requires an open conversation around sleeping arrangements, but it's not something that is impossible to navigate.
I'm really glad you say that, Vanessa, because I think for me, I always prioritize sleep above everything, because it regulates so much. It helps emotional regulation. It helps us with cognitive functioning, and the overall well-being. And if we're honest to each other and to ourselves, then having this clarity is key.
Yeah.
So guys, we're back. We had to rearrange the setting because of camera and stuff. Hope you don't mind. We still want to talk about one topic, and that is your own process and looking into what the male partner actually is going through. And from my perspective, Vanessa, when I work with male clients here in Hong Kong, very often what happens is men are prone to just toughen it out. They know it's not right, they don't feel right, but they don't want to rock the boat. It's already rocky, or there is frustration, there is maybe mood changes or swings in the house, right? And the male partners then, they typically would retreat. They definitely don't, as I said, don't want to rock the boat, and they don't want to add on to the stress or make it more difficult.
It's to acknowledge that men is a part of the relationship, is also going through a very difficult, potentially, phase of their lives, right? If you're in your 40s and 50s, typically, you've moved to Hong Kong, or your job is here, there may be some job insecurity, you're either dealing with young children or teenagers, your elderly parents may be back in your hometown where they're not doing very well from a health point of view. So there are things that are going on in your lives, and on top of that, you're expected to now be the support system for your partner going through perimenopause. So we are asking a lot from you, and we understand that it is tough sometimes because we are not able to articulate these things. But I think with perimenopause, it's not that it is a new form of stress, it's not a new disease per se, but it does bring on a stress to a relationship if there are already underlying cracks. So it's a bit of a stress test. So if the relationship had always been, quite strong, you had good communication style, you were able to support each other in times of difficulties, then you can transition and navigate through this very strongly together. But if in the past there have been things that come up, so either we are grieving as a process of, we're no longer as young as we used to be, my spouse or my wife is losing a part of her identity, or she feels she's losing a part of her identity, and that makes us change, right? Is it that she no longer desires me sexually as a partner, or am I no longer able to provide her with things that she needs? So it makes the men potentially feel lacking, right?
Yeah.
They're used to being able to provide, and now they're not able to provide the things that they don't know what they're supposed to provide. So everybody's quite lost.
And it's a natural inclination to wanting to make your partner happy, right?
Yeah.
And if you lose that ability, or there's a distancing due to these changes that are happening, and you're not, as you said, you're not prepared in terms of having already a good communication in place and a good connection, that might amplify the frustrations, the sense of resentment, but also the sense of the arguments that might emerge out of that.
And maybe it could feel frustrating for some men who are used to fixing problems that they can't fix this one, because it doesn't follow any particular rule book.
Yeah.
Right? With a pregnancy, we know roughly what's going to happen in the 9 months. But with perimenopause, it's very different for every woman.
Yeah. That was one thought that came up. It's just adding another layer of uncertainty, and because here we don't have a set that we can really grasp, it's even more important to hold that awareness and to be clear of your role and what you want to represent in the relationship.
Yeah. And so I think if your spouse snaps at you, or they're feeling distanced, and we amplify that by not expressing how that makes us feel, like how it makes the man feel, then the vicious cycles continues. Because when one partner senses the other one pulling away, then either they get hurt or angry, and then they respond by pulling away further, and it becomes this vicious.
The typical pursuer-withdraw pattern that then usually leads to escalation, right? Because the pursuer, oftentimes the female partner, will amplify the attempts to pursue in very unhelpful ways, oftentimes, and that will just lead to more withdrawing and leaving the picture, avoiding strategies on the male partner side.
Yeah.
Vanessa, I would like to end this section on like looking into how the male partners are affected, what they can do, and what is, from your perspective, from two perspectives. One, as you said initially, wearing the two hats. For each hat, what is the most important takeaways you would want the male partners to know about and to think about when they are actually leaving this talk?
Well, from a woman's point of view, I would like my male partner to know that I need an ally. Like, I need a partner right now because I'm going through something that is potentially very difficult and scary. And even if it's great, right, I would still like to reinvent our relationship because we're going through a transitional phase. And if we are thinking that, oh, everything will be exactly the same after that, it won't be. Because by the time we re-emerge, in our menopause phase, we'll be in our 50s, and either the kids will have been grown up and left, and there are multiple changes as well in our lives. So we want to come out stronger as a couple. And in terms of how that happens, you need to adapt the relationship to it. If you keep doing the same thing that used to work, it may not work now. Yeah. So open communication on how to grow that relationship is important.
I could not agree more, and I like that you used the word reinvention. I think this is here really one of the key points, to have that clarity, understanding, and also intentionality to work on this and say, where are we going? Almost like in a way, a spiritual intimacy that you will come up with, where it's about the meaning of life, where you find purpose together and you redefine that, you reinvent this, because it is life-changing in many ways. Mm-hmm. And to carry that awareness and to be as clear as you can and communicate also in that way.
Yeah. From a psychiatrist's point of view then, in terms of maybe advising couples on how to navigate this, I would say, well, seek help when you need to. Don't be afraid, because this is not something that needs to be scary. We do have enough scientific knowledge and emotional and spiritual support through this aspect of our lives, that you may not have all the answers, but it is out there. And sometimes having a professional help you means that it takes away a lot of the judgment, right? Somebody is there to help mediate the process. Somebody's there for psychoeducation even. Someone that you can trust to help you go through this together as a partner. And just because you've been with someone for a long time doesn't mean you know them in their new self, right? And so for someone to be able to voice that, like, we should go seek help together, is already a very brave move that can be the first thing that will start this process together.
Yeah, thank you, Vanessa. Appreciate the framing of that, finding a new body or being in your new self. That is very,